Welcome back, my good people, and in today's video I want to talk about an important topic in this particular booklet, Mother and Child Health Handbook, Afya ya Mama na Mtoto. Each and every pregnant woman around 13 weeks that is required for them to attend antenatal care. Though a mother can attend antenatal care, immediately she realized that she's pregnant. And we do encourage that you be given this book, and it is free. The MOH 216, so free book, which is issued by both private and government hospitals. And I want to talk about Rhesus factor. And Rhesus factor is one of the component of antenatal profile. And the reason why I want to talk about this is that we find that most mothers are not aware of what is normally happening in terms of their Rhesus factor. I will begin with saying that Rhesus is an inherited gene. It's an inherited gene. It's hereditary. You inherit from your parents, and half of the gene we inherit from our fathers. And this is a protein that is found in the surface of red blood cells. Those who have it are Rhesus positive. Those who do not have it are Rhesus negative. That's why if you order for your blood grouping and Rhesus, sorry, you will be told by your doctor, clinician, or even your nurse that you are either blood group A, O, AB, and they will add something on top that you are A positive, O positive, AB positive, or you are blood group O negative, A negative, B negative, or even AB negative. So this ABO factor arises in terms of knowing your Rhesus. So when a woman is Rhesus positive or Rhesus negative, there's an important information that we pass across. So when antenatal care has been done and you are a lady, it is very, very important to ask your doctor, or even to visualize in this book where it is written Rhesus, and you check whether it is written Rhesus negative or Rhesus positive. Now, why are we interested in this, particularly in women? In men, we don't have any problem, but now in women, when a woman is Rhesus negative, there is something that normally happens that now we want to discuss into details. Now, problems normally arise when a woman is Rhesus negative and the child is Rhesus positive. Now this brings about Rhesus incompatibility during pregnancy, particularly when the woman is Rhesus negative. Now this woman will form an antibody in her system, and these antibodies may attack the Rhesus positive antigen of that Rhesus positive child. This is because the B cells in this woman, after forming those antibodies, they will realize that this is now a foreign body. This is now a foreign body, and they will attack the cells and damage the cells of this Rhesus positive baby intrauterine, and this may cause a lot of damage to the blood, bringing what we call anemia, and it can even damage the brain by causing a lot of release of bilirubin, a condition called kernicterus, and even the baby's eyes and the sclera, you will visualize and see they are very, very yellow. So this is how you can detect a child who has been born. Though there is jaundice, we call it jaundice, this jaundice that occur physiologically, and this normally disappears with time, and there's a way we manage them. But when now a woman is Rhesus negative, then the first pregnancy might be very safe, but the second pregnancy can arise into this Rhesus isoimmunization that now the baby cells are being attacked, and this baby can have problems immediately after birth. Even this baby might not even celebrate his first week of life because of the brain damage, and now the brain cannot function and the body cannot function any longer. So the reason why we do this is that this woman we will manage by giving what we call anti-D immunoglobulin. It's a drug that we give intramuscular, and it's given around 28 weeks of pregnancy. We inject you this drug, and immediately you've delivered, around 72 hours, you will be given this drug again in terms of injection, and this will suppress the development of those antibodies that I talked about. So we encourage all women to visit the hospital when they are pregnant, so that this Rhesus factor can be determined in these particular women. Now, I want to tell you that there are some situations that a woman can be sensitized, that a woman can form these antibodies intrauterine, and it can affect the current child. In that, when you have perhaps early bleeding in pregnancy, and the one that we normally discourage, that external cephalic fashion, where you are trying to turn the baby, particularly when the baby is breech, in that now the presenting part to the pelvic cavity is through the buttocks. The baby is presenting by buttocks or footling. So before delivery, they will try to turn this baby to present via vertex or cephalic, and this is normally discouraged. So during this time, these antibodies can pass via placenta membrane and attack this particular child. And when there are quite number of antibodies, it can interfere with the development of this current child, and this can even cause miscarriage. So ectopic pregnancy can also make a woman to be sensitized, though this one can be managed by managing that ectopic pregnancy, but we will still give anti-D to this particular mother if we have realized that she had ectopic pregnancy, because the second or the subsequent pregnancies will have a lot of problem. So every woman deserves antenatal care, which now the government of Kenya is doing it for free. So even during amniocentesis, or even the time you perform blood collection through the placental cord, when you want to do some investigation, sometimes can make the mother to get sensitized, particularly if there's a leak of blood, and this will form a lot of antibodies, which eventually will create what we call hemolytic disease of the fetus and the newborn, and it is very fatal. It kills very, very fast. And there are scenarios that a mother is losing children perhaps 1 week or 2 weeks post delivery, and they peg it as I've been bewitched, somebody is killing my children, but they do not know that this is hemolytic disease of fetus and newborn, and they have not done when they have not been given the anti-D. So I'm encouraging anyone who is watching this video to kindly pass it across by sharing, subscribing, liking our videos, so that each and every woman to attend antenatal care, so that we will be able to know whether the mother is Rhesus negative or the baby is Rhesus positive. Problems do not arise when the mother is Rhesus positive. See you in the next video. Muchas